Welcome everyone. Thank you for joining us today for our Here for OIC webinar series. I'm happy to have Kim and Debbie join us today to have a chat about emotional, psychological, and social well-being. I think it's a very important topic always, but even more these days. So I just want to mention we'll answer questions towards the end. Feel free to send them in throughout, and then at the end we'll address as many as we can. So thank you guys for joining us. Off to you.
Thanks, Gabe. My name is Deb Gray, and I'm the manager of mental health promotion and illness prevention with Alberta Health Services. I work at the provincial level of Alberta Health Services, and my unit has been involved in disaster psychosocial response, supporting Alberta Health Services recovery planning since just after, well, actually around the 2011 Slave Lake fires. So we really got kicked into gear with the 2013 Southern Alberta floods, and then have been pulled in throughout the years with the various disasters that have befallen the province. And right now we're currently working not only on COVID response, but also still involved in supporting Fort McMurray's recovery from the 216 fire. And I'll pass it over to Kim.
And my name is Kim Savard, and I'm the program manager for the Way In, or Seniors Outreach at Carya. And Carya is a nonprofit in Calgary, formerly known as Calgary Family Services. So Carya is a multi-generational agency that has programs across the lifespan. We have about 150 staff, and our programs really are designed to keep people engaged and well in the community. And in my role as a program manager, I manage the Seniors Outreach Program. But the other hat that I do wear is the business continuity lead and emergency response lead at Carya. And fortunately or unfortunately, we've had lots of opportunity here in Calgary to practice some of those skills. So we're going to talk a little bit more about that in the presentation.
Great, thanks, Kim. So we have a bit of an outline here, and I know that in our title we say toolkit. It's sort of a virtual toolkit for you. And although you probably see this outline, you're thinking, holy Dinah, it's quite the laundry list. But what we promise to do is run through these items quickly, and Kim and I are going to try and be really snappy and engaging, right, Kim?
No pressure.
In all seriousness, so I can't even speak. I haven't had enough coffee. What we really want to leave you with or provide you with is really a brief snapshot of what a psychosocial approach is. You may have heard that term being bandied about. So you understand what it means and what it can look like in action, especially through some examples with Carya's work.
So like I said before, lucky or unlucky, Calgary and Alberta itself is had some opportunity to refine our skills around disaster response. And really the change in the psychosocial lens that we took on in Calgary really started with the 1999 Hub oil fire. And then you can see on this list on the slide, there's been a number of other opportunities really that had to respond to support the citizens of Calgary from a psychosocial perspective, but also from just the disasters perspective. And these are just kind of the highlights or lowlights, I guess, in some ways, that we have had in Calgary that have led us to getting quite a strong psychosocial framework in Calgary. So I thought I would just chat a little bit, because when you think about Carya as a nonprofit, or maybe you don't think about Carya as a nonprofit ever, but you're going to today, we again are that sort of multi-generational agency, and how did we get so involved in disaster work? So really, I mean, we were involved in a little bit before the flood, but during the flood, Carya, and formerly Calgary Family Services, and the other weigh-in network agencies that provide seniors outreach across the city responded to evacuation centers to support seniors as they were disproportionately impacted by the flood. particularly in that East Village area. There were over 1,000 seniors that were evacuated for a very long time. And as outreach workers and as our agency, we really were well positioned to support seniors, which are, tend to be a little bit more vulnerable, or can be a little bit more vulnerable in disaster situations. And so as part of the Emergency Wellness Response Team, which is activated by Calgary Emergency Management Agency, the 11 different agencies did respond to evacuation centers to really sort of help folks in that first 72 hours around sort of psychological first aid, or just getting them connected to the resources that they needed, checking in with them, that sort of thing. After the flood, because we had been so involved just in sort of the response phase, we did get some grant funding to have some staff then work with particularly seniors that had been impacted by the flood and were needing sort of longer term support in the recovery phase, things like navigating insurance systems, trying to figure out what it looks like going forward, particularly for folks that maybe didn't have a lot of natural supports, or maybe some cognitive impairments, those kind of things, and really needed that sort of really supported work to help them through getting sort of back to a so-called normal state. And we learned so much in the flood, and we as the entire city, but also as through our emergency wellness response team. I guess one of the things we always say is that these disasters and emergencies give us an opportunity to change and learn, and we learned so much in that first sort of response as the flood was going on, and we got much more clear around how we needed to develop a framework. And we developed terms of reference. We had some training, baseline training that we needed to, or we expected all agencies to get involved with. And we really took a look at how, as agencies, we needed to come together and work differently. The other thing was that we realized very quickly after the flood that seniors were well prepared for emergencies, and in collaboration with Alberta Health Services, we developed what we call our ePrep program. And ePrep is a 2-hour facilitated program that supports participants to prepare practically for disasters by developing an emergency kit, recognize signs and stress and wellness strategies, and the importance of developing strong social networks. So we played, HS and carya developed this ePrep program really at first in order to help seniors be more prepared. But as we offered it out in the community, we realized that this tool, this ePrep program, really could be something that could be spread and used to help folks in the recovery phase, talk about their experiences. And then we, with Alberta Health Services, it ended up being up in Fort McMurray a year later, using ePrep as a tool to bring community together and talk about what had happened after the disaster. Shortly after that, we got together again with some United Way and Alberta Health Services, and we launched a psychosocial disaster summit, where we brought government leaders, civic partners, and other agencies together to just really talk about how could we come together better as sectors in post-disaster. And then one of our more recent projects is, and it's a really long title, we launched a integrated nonprofit business continuity program with the critical service provider group that is part of the city program. And we got some funding from Red Cross through United Way, and we pulled together a steering committee. And we offered folks, agencies in the community, opportunity to come together to have one-on-one support and workshops to complete their business continuity programs. And we really wrapped that up just late fall, and then people had their programs, and we were moving into, in the spring, thinking about doing a tabletop exercise. And and we've not had to do a tabletop exercise, as the pandemic or COVID-19 has really required all of us to take that business continuity program and put it into place. So we again rolled out those business continuity programs and realized, you know, these were the things that worked really well, and then these are the things that maybe didn't work so well. The other piece around that integrated program, business continuity program, was the intention of it was for having these nonprofits come together to develop their own plans, but to take a look at how, in a disaster situation, we could potentially support one another. And a prime example that we had just even in this situation was that when the kind of March 10th, 11th, 12th, as things were starting to ramp up with COVID-19, and we're starting to think through, at least in our agency, okay, how are we going to work? We're going to send people home. What does it mean for our core programs? Because we had this program and existing strong relationships, on that first weekend, we worked with the distress center to think about how can we help them, how could they help us, and we kind of pivoted around how we normally do our work. So in fact, some of our staff actually took over answering some of the 403 seniors lines, so that the distress center had more capacity to respond to 211 and crisis lines. And I think, you know, we had strong relationships beforehand. We went through the business continuity project, and we recognize that agencies have assets and capacities that they could share in the middle of a disaster. So I think that's just kind of like how we as a nonprofit have really moved from sort of being a, you know, slightly connected to, say, a disaster, to really taking a leadership role in disaster preparedness, response, and recovery, in a way that if you had said this 15 years ago, you wouldn't have said that carya would be a disaster response agency. But it really fits really well with what we believe around community resilience and individual resilience, and how we need to support folks prior, during, and after disasters. Just one other thing that I wanted to mention just in this slide was that as an agency, we also, you know, really our leadership is really committed to this work, and to the point where we have all our staff all go through our EPREP program, so that as they come on board, they attend an EPREP program. We get them trained in psychological first aid, because the sense is that we don't feel that unless our staff are fully prepared, that they can help others in community. So that is a core tenet of ours, is we have our staff prepared for emergencies, so that they can feel confident that they're personally prepared, so that they can help others.
Kim, may I interrupt? There's a question now that you mentioned the EPREP. Is the EPREP available for businesses to use as part of contingency planning?
Yeah, and we're going to talk a little bit more about that as we go further on. And we are talking about EPREP as a tool in recovery as well, because the really nice thing about EPREP, again, and we saw in Fort McMurray, was that people will come to an emergency preparedness workshop because it's not super, it's kind of non-threatening. You know, I'm just going to talk about getting my 72-hour kit together. But bringing people together to talk about that, and then there's some wellness strategies and looking at your own personal stress, and then that social connection piece. And we've been making a few jokes, and that they're probably not that funny right now, but about when we heard after the fire in Fort Mac, when people were leaving at Fort Mac, and the crazy things they took as they evacuated from Fort Mac. We heard lots of those kind of stories when we were in doing EPREP in Fort McMurray. And my guess is we're going to hear lots of stories about hand sanitizer and toilet paper in this one as we go into recovery. So yes, so we'll talk about that as what the opportunities would be for businesses to take EPREP and how we would support that.
Great, thank you.
I think Deb's frozen.
Deb, can you hear us?
Uh-oh.
Uh-oh. So let's see. Sorry about that, guys. Looks like her internet's having some issues. Do you have a next slide, Kim?
I have it on my other
Okay.
Can you move
Okay.
it, Gabriel?
I can start sharing it for everyone.
Okay, and I could speak to her notes.
Let me know if you can see that.
Can see the slide, it's at the first slide, Gabriel.
Okay, I'll move it up.
Sorry, I'm back.
Oh, perfect.
Oh, okay.
All
I
right.
apologize.
That's okay.
My audio has been dropping lately.
I'll just get you to present your screen again, Debbie. Can you see that, Debbie?
The joys of technology.
Looks like her internet is struggling. Let me I'll put up the presentation for you, Kim.
Okay.
All right. So I think that was the next one, yeah? Yes.
Yeah, and I just as the one other thing I'm just gonna say is I'm just gonna while we're waiting, see if she comes back on, is that I talked a little bit about the emergency wellness response team, and there are 11 different agencies that are involved in that. And the mandate is to ensure impacted individuals are provided effective psychosocial wellness support to promote their resiliency during an emergency. And this EWRT is, again, a collaboration with Calgary Emergency Management Agency, Calgary Neighborhood Services, AHS, and the Emergency Wellness Response Team. Okay. All right, I will just take over Deb's notes and hopefully she shows up. So this is the psychosocial disaster phase. This graphic introduces us to the emotional highs and lows people might experience through the phases of a disaster. In the early stages, we might see emotional highs as people band together to help others and feel good about the support they both give and receive. There is a sense of community and a banding together. As time progresses, however, some of the realities set in, such as financial strains and having to put life on hold. People may become more disillusioned about whether they will receive the help they need and feel those emotional lows. From the low, it's not a smooth trajectory upwards, but it does come up over time as people start to rebuild their lives and build up resilience. Building that up takes time, which is why a psychosocial support is needed in the recovery phase for at least 5 years after a disaster. We know that, for example, for Hurricane Katrina, it's been over for 10 years. Some Indigenous communities continue to be in recovery from the southern Alberta flood 5 years ago. Compounding disasters, including the economic disasters in Alberta, make recovery also more complex. And Fort McMurray would be a prime example of that right now. They were, they had the fire, then they were also dealing with an economic disaster, and then they just had another flood. So, I mean, there's multiple disasters, and even here in Calgary, as COVID and the pandemic is going on, we've been having conversations about concurrent disasters. What if we had a flood? What if we had another fire, et cetera, et cetera? And what would that look like? So these phases into the disaster are being seen in this pandemic as well. But the pandemic is not one discrete event. It is protracted in its impact over many months and is predicted to resurge with more waves. And this complicates an already complex trajectory in Alberta from all our previous disasters. And I know We've had lots of that even happen in the last month, just around we're opening, we're not opening. There's going to be a second wave in the fall. So it's not a linear process.
Sorry, Kim, I'm back.
Okay, we're on 5 essential elements now.
Okay, sorry everybody. Thanks Kim for doing my slide. So the 5 essential elements, and really this is really
You need to move the slide, Deb.
sort of giving us a, oh,
there you go.
Oh, there we go. Is really telling us what we can do. These are considered the elements that are most essential in response work. And if you look at this illustration, you can probably recognize some of these types of messages around safety, hope, being calm, and also these are some of the elements and some of the initiatives that have been provided. These are also things that not only that we can focus on, but things that you can focus on as well in your communications with your staff, or how you're communicating around the impact of disaster on your respective businesses. Other elements that have popped up through literature that I think that add to these 5 essential elements, and they're allowing for grieving and mourning. And that's not just a death. Grieving and mourning could be the way things were. Loss and change is a huge part of this. The not knowing, the uncertainty. There's lots that can be going and making space for the grief and mourning of loss other than death. Establishing a sense of place. You know, a lot of this has not only to do with sort of, you know, communities, our sense of place, of being, belonging. It could be changes in that sense of place. As we were talking with Gabe before we started our presentation, it's even that change of working and how we're working, on site versus remotely, the pros and cons of that. That sort of changes a sense of place. You sometimes see establishing a sense of place more in physical disasters than this, but it's definitely a consideration for COVID. And then reestablishing a link to the past. A lot of this again is routines that have changed. I know that in my circles, maybe yours as well too, is what we considered or took for granted prior to COVID compared to what we do now, and just that questioning of what things might look like going forward as we move into recovery. Oftentimes, it's the additional stressors that people need to cope with that can negatively impact their mental health or exacerbate mental health concerns or illness. And it's often these larger social factors such as job loss, loneliness, and isolation, and especially the fear of the unknown that can really have an impact on how well or how people are coping. And so really the psychosocial approach to supporting disaster recovery is looking at some of these larger societal factors and its impact on people's well-being and their thinking, and how do we start to address those early to prevent addiction and mental health issues down the road. I don't think I have control, so the next slide, please. So really, when we're taking a look at a psychosocial approach, what we're looking at is how do we add to or an adjunct to our more formal addiction and mental health services, shifting our population or adding our population to whole populations. It's really about helping people meet their everyday emotional, psychological, and social needs, keeping them in functioning mode. People in motion stay in motion, and that's really what we're trying to do, is to make sure that people don't shut down, that they're able to function, whether it's working remotely or taking care of their kids. Huge one is you know, ensuring now you're working from home, you're trying to keep your kids in school, you're trying to do all this stuff. There's lots of stuff that's happening that is different than what we did from our usual or pre-COVID routines. A psychosocial approach is really looking at a population health lens through when we're looking at disaster, all the phases: response, recovery, and even preparation. It might be odd right now to talk about preparation in the midst of a disaster, but preparation is a really important aspect in terms of recovery, because it's the struggle with not having that control. not wanting to just have a bit more sense of being able to tackle the unknown. And really what we're taking a look at disasters through is really a public health lens. We're seeing disaster as how it's impacting public health issues. So at the core of a psychosocial approach is really supporting population health. It's really about strengthening community action, building social capital through community development, and really shoring up the natural supports and working with leaders in various groups in the community, including you as business partners. Is not to say that you don't have an important role in the recovery of community, and not just from your staff point of view, but whole community. The messages and what's happening to your businesses, whether they're staying open, they're returning, they're opening up, is really that going back to some of those 5 essential elements. It's instilling that sense of hope that we are rebuilding, we are moving forward. We're trying to get back to that new normal, what it might look like. So next slide, please. So this is our step care approach. And really what it's doing is that it's really an illustration to say who needs assistance and when do they need it and what do they need. And really, at the end of the day, we all need some sort of support, but not everyone needs the same level or all the types of supports that are available or support at the same time to help them cope. And so what this illustration is doing is that it's showing us the various steps of support and what proportion of the population will need what and when in their recovery trajectory. The objective is finding that right level and type of support being offered at the right time. The most meaningful and most effective type of support for people is the most timely or meaningful support. So it's trying to match what they need at the right time. Keeping in mind that the best recovery outcomes post-disaster, when we're moving into post-disasters, when all organizations such as AHS and carya and others work together to support natural supports and strength, and that we're not just focusing solely on clinical support services. And so as you can see, clinical services is more the smaller tip of this inverted triangle in the last step. And we invert this triangle purposely, and it's positioned in this way to show the psychosocial effects funneling down to more clinical services as being the last step, not necessarily the first step for intervention. So it's not to say that clinical services aren't being offered, but it's not what we're putting all of our efforts into. And it's really taking a look at the stepped care, because we know that clinical services aren't required by everyone, and it's not necessarily the biggest focus for disaster intervention. This step care approach is not unique or not created by Alberta Health Services or carya. It's an international model that we first introduced around 2011, was really put into practice for the 2013 recovery. And it just goes, and it since then has gained sort of acceptance, and it's quite common and found in most disaster prep, either discussions or plans at various levels, municipal levels and others. And it's one that you'll probably even see or are seeing even on the governments of Alberta sites as well too. So next slide, please.
All right, and as you can see from this very beautiful slide, that that disaster recovery is not owned, or nor can it be responsible of any one organization or agency. This model, the recovery cycle, shows it's very complex and involves a number of different factors, including factors, players, and actions to support individuals, families, and communities to work through the process of recovery. Recovery is not measured in weeks or months, but years. The recovery process is never linear, and this will be especially true for the COVID pandemic, especially if we experience future waves of the illness. As we've seen in Fort McMurray, the wildfire recovery, the economy, finances have a huge impact on the recovery trajectory, and the recent flood coupled with COVID will only be compounded. We are responsible as a community for recovery, so everybody in the community has a role to play. And one of the things that we know, and through lots of the research that we've done as well, the pre-existing functioning and health of a community, be it geographic or communities of people, will be a good predictor of recovery. And that's why we put so much work into community development and building strong relationships in non-disaster situations, with the hopes that strong communities can help one another out during a disaster, and then the recovery trajectory is a little bit smoother. And possibly quicker with less sort of longer term impacts. The mainstay of a psychosocial approach and planning is a strength-based approach, and working to build and enhance communities, communities' disaster psychosocial capacity for recovery. Because you can see all these types of agencies and organizations play an important role in the recovery and well-being of individuals and the community that they live in. And one of the things that Deb and I have chatted a little bit, and we were talking about Gabe before the presentation, is one of the things that we've been very lucky, I guess, again, is the nonprofit sector and big systems like Alberta Health Services and the city have really done a lot of work together over the last few years just to be really collaborative. And this today's presentation and some of the other discussions going on feels like there's an opportunity here to really start to work more with the business community around this psychosocial approach. So I think that's one of the reasons we're really happy to be here today, to sort of think through what that might look like. Next slide, please. All right, so we're not doing very well at we're doing lots of sort of issues and things, but we felt like it's really important just to talk about some of the stuff that is going on with this pandemic. As much as this is a health disaster, it's also a social disaster, and it's due to the necessary public health guidelines and the restrictions that have been implemented to control and reduce the rate of transmission. And there's so many layers to this, and I know as an agency we're very, very concerned about the social isolation that's going on for folks and what that means in the long run, and folks that maybe don't have any natural supports or connections, that's just going to be a bigger issue and longer term, and we're trying to find ways to mitigate that. Disasters, regardless of the type, have the ability not only to create new issues and needs, but to also spotlight gaps in systems and exacerbate pre-existing issues. And I know, as most people will have seen in the news, the long-term care situation, and there's lots of spotlight on that right now, in that, you know, is our system set up in a way that in the right way to help support these folks. There's certainly social isolation and loneliness, you know, an increase potentially in domestic violence, and, you know, we're starting to see some signs of that, increased substance abuse, employment, income, and poverty issues, housing and food security. And I do know as one of the roles that our agency is doing is food security has been a huge issue just in this first 8 weeks for folks that are isolated and maybe don't have any sort of resources as well. So these are all the issues that we're starting to see, and I know, I apologize, the writing is fairly small. I think we're going to be able to share this PowerPoint out afterwards, so you'll be able to maybe see some of the other things on it. These factors can have a negative impact on mental health, requiring supports that were in place pre-disaster or because of COVID. It's the social impact of some of these issues on mental health, which is why a psychosocial model or approach can be very effective, and why since 2013, Alberta Health Services and other organizations, the nonprofits, the city, have really incorporated this approach into disaster recovery planning. Next slide. And then one of the things that I really like this slide because it talks about, you know, we talk a lot about mental health and mental wellness. One thing, this is a global pandemic, and there isn't anybody, I don't know that there is anybody that is not impacted by this event. You know, we've had the floods and fires, but if you didn't live in an affected area, or you were someplace else that you might not have been on your radar, but everybody is impacted across the world in this. And one of the lines that we use when people are saying, you know, I'm so stressed, or I'm not sleeping, or I'm drinking too much wine, or, you know, I'm eating too much, and something like that, you know, all those things that you're hearing people say, quite often we use the term that these are normal reactions to an abnormal event. So there's not anybody I know in my circle or my work world that isn't impacted and showing some signs of stress in dealing with what's going on. The problem is, when those sort of normal reactions turn abnormal, or where people are not being able to function as well. And this graph kind of shows a nice trajectory around, okay, these are the things that it's pretty normal to be feeling these things, and and what are the things that you can do to deal with them. And there's all kinds of stuff on the internet or social media talking about self-care and what you can do. Don't watch the news, or limit your news intake, go for a walk, have a bath, light a candle, all those kinds of things. Like, what is it that you need to do for yourself and encourage either your employees and or your families to do to manage this stress, the social isolation, whatever is going on. It's when you move over into sort of that continuum where you might be saying, okay, this isn't working for me or that person anymore, and you want to be looking at getting some intervention in where things are not functioning day to day, or you're not able to function day to day. And we did hear in one of the meetings last week, one of the business owners said, I'm a business owner, I'm not a psychologist. Like, how do I like, this is not my normal day-to-day world, but I'm seeing my staff show up with real challenges, and what's my role, and how do I get recognize what they need. So in that sort of orangey red side to the slide, these would be the things that as an employer you might want to be saying, okay, things are moving to a place where that person might need some more referrals. And again, there's things like threatening or intimidating behavior, endangering lives of self or others, self-harming, suicidal thoughts, excessive crying, known dependency on substances, alcohol, gambling, etc., confused or disoriented, incoherent, unresponsive. So, I mean, those are just the real sort of really, truly red flags where somebody is going to need some more support. My next slide.
So I don't know about you, but there has been an overwhelming amount of information available. And I know that choosing what is the most accurate and up-to-date information can be the most overwhelming bit about all of this. It's not if you can find information about COVID or how to support or how to cope with it. It's what to listen to or where to go. And even health professionals, we're finding the same thing. There's just so much out there. So what Kim and I thought we would do is that we would provide some of the key resources for you. We're not saying that these are the only ones or are there isn't value in taking a look at other sites that aren't mentioned here, but we just wanted to give you some of the key ones. 211, we can't say enough about it. 211 is Provincial. It will show you probably, because they have a whole team working on trying to get daily updates and the most up-to-date changes in terms of services, in terms of what's opening, what's changing. It's a really good organization that can also, not only you can chat to, but it has a website and it also has a chat feature. And so that one would probably be what we'd recommend as the one that you'd want to drive either employees to or even to yourselves to just take a look at what might be out there in terms of services and some of the supports. They're also very, the 211 group is also very, very keen on working with community to post updates as well too. So if there's things that maybe collectively as a business group or whatever that you might want to post, that's, there's always the opportunity to check with them to see whether or not, and if it's really public outward facing where you really want to reach a lot of people, that might be a good opportunity, a good group to work with. 811, you probably had this number burnt into your memories. So 811 is AHS's health line, again, for COVID information, any sort of health information. What's happened with 811 is because of the overwhelming number of calls, AHS has opened up and added to and created the addiction and mental health helplines. And so those are additional lines to increase the support and capacity of calls coming in. And a lot of those calls primarily are people looking just to be able to find support, talk to people, and from that, people will be redirected to other supports and services. And it's also a line where people can chat and receive light support, but it's not per se the crisis line to call. Again, 911, if anyone is in immediate danger or anything like that, that would be immediate threat to themselves or others. That would still be the #1 line to call to. But in Calgary, we do have the distress center, the access line 211-811. On websites, AHS Help in Tough Times, another source of information. There's a lot of information there that can be downloaded and shared. The City of Calgary website is another good one to go to. They have a number of different categories, especially on social well-being, community wellness, and of course the United Way website is another one. It's a key one that you can go to in terms of not only initiatives that are happening, potential funding opportunities, even for business, but also what are some of the bigger initiatives and supports that are going on within the city, and also to a certain extent provincially as well, to be able to tap into. There's a number of things that are also going to be launched in the next little while. I think that the big thing is that, and this is a little bit of the issue, is that how much are we moving towards opening and going back to in-person supports versus what we're offering versus using platforms, which, as you can tell today with my audio and stuff, sometimes the virtual option can be really good and sometimes it doesn't work that well. But knowing that there is that need for physical distancing, some people aren't or able to get into different sites, you're going to start to see in the coming weeks a lot more virtual lines or virtual supports coming online, I should say. There's a big white wall, which is going to be a peer support driven platform that people will be able to sign on to. The launch will probably be in either later this week or early June. It's probably early June, most likely. And you'll be seeing resources or supports that people can self-navigate through those. I know for us in AHS, it's moving towards virtual platforms such as Zoom or other platforms to offer either training, workshops for the public or even professionals or even lay support. And that's been a big struggle too, is trying to take information and change it so it can actually be successfully facilitated virtually. And there's a lot of stuff that will be coming up in the next few weeks, and that's also available right now. So it's not that there isn't, it's just that you're going to see a gradual things returning in terms of services opening and coming on board, plus new things that are coming up as well too.
And Deb, I just wanted to mention that we sent Gabriel the EWRT agency resource sheet that can also be sent out to folks if they're, or we can send out that if their people are interested.
Awesome, yeah. And so any of these websites, either 211 AHS, United Way, and to a certain extent the City of Calgary as well too, will have all the different links and accesses to some of these different resources. So next slide, please.
All right, and I'm just conscious of time, so I'm going to leave a little bit of time for questions, so we won't go on too long on this. But out of everything always comes opportunities, and I do think that I know that as a nonprofit for us post flood, the opportunity to work differently in community presented itself, and particularly with the City of Calgary and Alberta Health Services, and it's not just our nonprofit agency, it's all nonprofits. There was much more integration, so that need to build relationships across agency sectors and in the community. And one of the things that it keeps coming back around is that we need to build these strong relationships in between events. because that's how we can mobilize quickly. So when you know somebody and you trust them, you can phone them up and say, hey, this is going on, I need your help, or I can do this for you. And you have a level of trust already. It's really hard to be exchanging business cards in the middle of a disaster and say, hey, you know, this is who I am and this is what I could do. But if you already do have that those relationships, I think that's critical. And we worked really hard at maintaining those in between disasters. And one of the learnings that we've had always is that, you know, around the times of these disasters, there's potentially more money or more opportunities for collaboration. And the further out you get from a disaster, the harder it is to maintain those relationships. And but it is still very, very critical. And we learned that post-flood is, you know, the further out we got from the flood, you know, the less meetings there were, say, around disasters or the psychosocial disaster network. But when the fire, when we had to respond to the fire and the evacuation centers were open, we had still kept those relationships going during non-disaster events. And so that really stood us well for then really quickly moving into the response phase for the wildfire. And I do think one of the things that, you know, we talk about, or we have been talking about in this last month, is how do we work more closely with the business community, particularly around supporting staff and even, you know, employer wellness. And so that, you know, that feels like there's maybe an opportunity to look at that. And how does the business community support the rebuilding and in the recovery stage? And I have, you know, personally as the agency, and you see it in social media, there's been a lot of businesses that have pivoted, and you know, beer makers are making hand sanitizer, and like we need hand sanitizer to do our work. Like there has been lots of these informal relationship building that's already happened, but how then do we take what happened here and then build on it going forward? And I do think there's always these unintended outcomes. So we build these relationships, you know, in the middle of a disaster, and then something else comes up that's not even related to a disaster, but you already know somebody, and you say, well, I know that person, and why don't we get them involved in this? And I think, again, that there's some opportunity to do that here. And we talked about, somebody had asked a question in the middle, somewhere in the presentation, you know, what are the opportunities for training? And as Deb said, we have really looked at how do we do training in a non-in-person kind of way, and then we've learned all kinds of new platforms, Zoom and Microsoft Teams and webinars and all that kind of stuff, and we have started to make those kind of changes. So Alberta Health Services has done a brilliant job at taking psychological first aid and putting it online as a 2-hour presentation. And then we are in the conversations about taking that 2-hour facilitated emergency preparedness course and seeing how we can do that online. And we do have some sense that summer might give us some space to do that. There's some heart math work that's being done, that's being put out into community just to help folks with self-care and those sorts of things. So we are adapting, but I think it's taken time just because we are still trying to maintain core business. And then to make all the changes it takes time to do some of that kind of stuff. And the one quote that I did really like, well, the one that's on the screen, and we move at the speed of trust, that's my favorite all-time quote, and there is a book around that, so it's not my quote, but we do move at the speed of trust. So if we have trusting relationships, we can move far quicker if we have developed these strong relationships. But then the other quote that has come across my desk a number of times is, we are all in the same storm, but we are not in the same boat. So recognizing that everybody's going through this in a different way with different challenges, and we have people that you know, are trying to homeschool or not homeschool, or, you know, have lost jobs or trying to maintain businesses and etc. Everybody has a different story, and I think just we need to be kinder and gentler with everybody, because we don't know what people are going through. All right, next slide. I think that's kind of what we wanted to do today. Did we manage to leave a little bit of time for questions? We did.
Yeah, we got a couple minutes. I don't see any questions yet other than the one we already answered, but if you guys have any closing remarks to go through, and if any questions come in that time, we can address them.
Great. I don't really have anything other than I know that we kind of gave you sort of a broad overview, and there's just so much information that's out there. It's just sort of choosing what's relevant. But I hope that what we've provided you with today is just a bit better idea of an approach. Also knowing that businesses are a key component of sort of the overarching community recovery plan, and that there are opportunities for you in terms of either some training or some other supports that are out there that you can shore up your EAP or other resources that you're providing your staff and others. And the most important, that also for yourself as either business owners or managers or leaders in community is modeling that sort of self-care and making sure that you're also taking the time to take care of yourself, because there's a lot of different pressures on you that might not have been there pre-COVID, a lot of unknowns. And as we'd say to first responders and healthcare providers, it's a marathon in terms of trying to run through the whole course of COVID, because we just don't know how long it's going to be. And keeping in that mind for yourself as well, that you too need to pace yourself and take care of yourself, because you're an integral resource not only to your company and your staff, but also community and to us.
Well, thank you so much, guys, for joining us today, and thank you to Kim and Debbie for this great presentation. So, like they mentioned, all the resources were available to download here under your handouts, or you can feel free to reach out to us and we'll provide them to you as necessary. So thank you again for joining us. Thanks, guys.
Thanks, Gabe.
Welcome.
Thanks,
Thanks
everyone.
for
Bye
having us.
now. Have a great day.
You too.